If you're having sciatica and the nerve pain's going through your butt, maybe it skips your butt, it's going down your leg, back of your leg, front of your leg, goes down to the foot, then this video is specifically for you. We got somebody that asked us a question. They said, what do I do? Because the nerve pain's much better now. And so they want more extensive video on how they get the nerve pain out of their foot and out of their leg. So we're gonna go through that in this video. We're gonna look at a little bit of the anatomy, and we're gonna show you the tools that we use to help our clients get out of pain at home. Let's get right into the video. We've got a ton of tools right here, okay? So I got rolling sticks, I got a Mobo, I got a gun, I got this massage ball that it shakes around, right? Some that don't get it going too crazy, lacrosse ball, and then this thing. So what I really want to talk to you about is that nerve has been irritated for a long period of time. When the nerve gets irritated, it starts misfiring. And when it misfires, you're going to get muscles that start engaging and trying to create stability. So we've got to loosen up. We got to follow that nerve all the way down, but we don't want to be directly on the nerve. We want to be around it. So think about this as being muscle right here, and that nerve is running through it. I don't want to put any of these tools directly on that nerve. I'm not trying to grind on it. I'm allowing it to heal. So I'm going to dig out the muscle on the side. I'm going to dig out the muscle on the side, and we're going to get that nerve to start gliding around. So this does not replace the exercises. It doesn't replace rolling out on the glutes. It doesn't replace hip hinging. We've got to do that in conjunction, but we've got to loosen up the nerve down the leg. So I'm going to show you exactly how we do that and where we do it. So here, taking the glute away, if we look at it, that sciatic nerve is right here. So it's right on the inside of the butt right here, and then it's coming straight through the hamstring right here, and you can see it down there. So when we're looking at the sciatic nerve, I don't want to be directly on it. If you're superficial, if we're working on this area right here, you're okay, right? If we're directly on the nerve at the top, typically irritates people. Right here, we can work on the calf too. If you are getting zinging pain going down your leg when you work on that area, it's too aggressive. We need to back off a little bit. So first thing, let's look at the hamstring. The question was, what should I do if I still have nerve pain down my leg, but my back has gotten a lot better? So we're gonna roll out that hamstring. I'm just gonna put this ball right here underneath my leg, and then I put a little bit of pressure into it, and I'm not gonna fold in my back. I'm keeping my back in a neutral position. I put a little bit of extra pressure on it, and then I'm coming up right here. So I can loosen that up. We always tell our clients to do about 10 swipes. So I wanna be on the outside of the hamstring, I want to be on the middle of the hamstring, and then on the inside of the hamstring right there. Now, we can do that same thing with this Mobo right here, digging that out. And it's best to do both legs, but if you have one leg that's really bothering you, then we want to use that. Now, in the lower leg, we know that the sciatic nerve is going through the middle, but it also splits off. We just want to loosen up the whole calf. So what we're going to do, there's a spot right here in your leg. If it feels tight right there and tender, we want to work on that. So this right here, I was working on it yesterday. That one is really tender on me, but on this side, it's not tender. So I don't need to work on it if it's not tender. Where muscles are tender, there's typically adhesions, there's hung up tissue, and that's going to cause you problems. So right here on the inside, I'm also going to do the front on the anterior tib right here. I'm going to do the outside right here. These are the perineals or the fibularis. So right there on the side. And then I'm going to do the back of the calf. So I want to do all of that stuff. Now I have all these tools right here. So I can do this and glide. So I can get two of these areas on the calf at the same time. I can be sitting down and I can get the back of the calf right here. So if you see it from the side, I'm digging that out. When I do this, I want to do one line of tissue, and I want to do it for about 30 seconds, 30 seconds, 30 seconds. The front. So I got about 2 minutes doing the front of the leg, and then with my hand, I'm just going to get in here and loosen that up. And I do it for another 30 seconds, loosening that stuff up. When you do it, we can use a bunch of tools. So this is a rolling pin. I can do the same thing with that. And then I can do a massage gun too. So if you find a spot that's really tender, it's hard to break up, we turn on the massage gun. You can use any massage gun. Most of them are about the same. I'm not gonna review massage guns, but I'm just digging that out. I'm doing 30 seconds kind of coming up and down. I'm still following those same lines of tissue, those same muscles right here on the side of the leg. See what kind of noise that makes. The front of the leg, off to the side, back of that calf where these big muscle bellies are. Can't really see it. Big muscle bellies right here, okay? And so we're gonna loosen that up, and we wanna do it consistently. Now, with this one's an interesting one. We can put a link in the description. It's called roll recovery. This thing's pretty intense and it's hard to open up. But what I do is I'm gonna pull it right here. I don't wanna be on my bone, my shin bone right here. So I'm gonna pull it out and put it right here on the sides. And I can get a lot of pressure with this. And this is my favorite place to use it, is on my calf. Now, all the other stuff is gonna work really well. This is just quick and dirty. I can get a lot more done faster. I can come right underneath that same spot we were talking about, working right here inside that tibia right there. That's pretty tender. I can hug this right there and I can dig into it. Now, if I put a little bit of extra pressure into it, it's really tender. So be gentle with yourself. Don't cause yourself any extra pain. Remember, we wanna be around the nerve, not directly on the nerve. We do that, we have all of these. This one can go underneath the hamstring, we get it sparked up. So a lot of people will argue that without vibration, you're not gonna get as much out of it. So these vibrating tools and balls are really pretty cool. And so afterward, if you're going down the leg, afterward, what are you gonna do? We wanna get blood flow to it. So we would do heel raises, firing them up, and then we would do a stretch. So we've loosened up that tissue, so we broke it up. Then we got blood flow to it. You can do it in standing, you can do it in sitting, and then we got to do a stretch. So there's two ways that we're going to stretch that calf after we work on it. One is in seated right here, so I can press down and loosen that up right here. And then the other one would be in standing, where you wouldn't be able to see my head, so I'm just going to lean down right here. And so I'm doing this, and I'm straightening out right there. I can do knee straight, knee bent, and the same thing, knee straight, knee bent, and I'm doing 30 seconds in each position. So I want to do that consistently, especially if you've been dealing with this for a long time. You've had a long time of that nerve misfiring, and this is exactly what I would do with my own kids, with my family. I'd be loosening up all that tissue, and you have the power in your own hands at home. So get yourself some of these tools, start breaking up the tissue. One thing I did want to touch on is I'm not going to lay down on the ground and put my leg on this. I don't have any pressure. So I need something in my hands that I can grind out that tissue. But be gentle with yourself. Make sure that you watch our video on sciatica. What are the best 3 stretches for sciatica? We got to do stretches, we've got to do exercises, we've got to lengthen that tissue, and we've got to do that consistently. We really have to work on our hip hinge. So make sure you check out that video. We'll see you in the next one. Get mobile and stay active.